Thank you all for joining us for tonight's webinar. Tonight we're looking at brain health and cognition with Dr. Cynthia Honan, and I'm Andrea Salmon. I'll be your facilitator tonight, looking after the questions and running through the program. We start all our programs by acknowledging and paying respect to the traditional custodians, past, present and emerging, on whose lands we meet today, no matter where we're signing in from. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and we respect the cultural authority of the elders in each community. It is my pleasure to have Dr. Cynthia Honan online tonight. Cynthia is a clinical neuropsychologist and senior lecturer at the School of Psychological Sciences at the University of Tasmania. She also holds appointments at Launceston General Hospital and the Menzies Medical Research Institute in Hobart. Dr. Honan is an experienced neuropsychology clinician, having worked with people with MS for over 12 years. Her research focuses on cognitive functioning, fatigue, social functioning, and employment outcomes in MS. Cynthia is also currently investigating brain and gut-based biomarkers of cognition and fatigue, and the impact of sleep quality on everyday functioning. And I know from talking to Cynthia earlier in the week in preparation for tonight, she's got a lot to talk to us about tonight. So we hope you're strapped in for the journey.
Thank you everyone who's come along tonight. I really appreciate you being here to listen to me talk for an hour. Now, some of you I probably have met before, and some of you I haven't. You know, I always have this bittersweet feeling about doing online talks. You know, it's always nice to get together so I can talk to you in person, but then by having it online, it does open this up to a lot more people, you know, in regional areas, which I think is great. And being from rural areas myself, I think that's really, really important. So I do have quite a big presentation for you. I'm going to speak from the point of view of giving you some practical advice, which I do quite often in a clinical setting, but I will also talk to you as well about some of the research that I have been doing, and also some of the research that is coming out at the moment about brain health and the relationship that brain health has with cognitive functioning. So without further ado, just in addition to what Andrea said, I just wanted to pay respects as well to the Palawa people of Tasmania specifically. I won't go through this entire acknowledgement. I think Andrea has done that well for me. So just an overview. I'll first of all introduce you to what cognition is and how it applies to MS, and then talk to you about some of the more common strategies I often recommend to people in clinical practice that might help them with their level of cognitive functioning. And then I'll talk a little bit more about brain health and cognitive functioning before I open up for questions. So first of all, what is cognition? Well, cognition, it is quite a complex thing, and I think often what comes to mind firstly is that cognition may be more about memory, but it's a little bit more involved than that. In terms of a more formal definition, and in fact I've got the Wikipedia definition on the slide there, which I find quite a good simple one, but what cognitions are, it's those mental processes or mental activities that help us undertake everyday activities and behave in certain ways. So it's those processes in the brain that help us know things, to remember things, to understand things and communicate things. And it's basically those processes allow us to cope with our everyday environment. Now, there are numerous different types of cognitive functioning. Some of them we refer to as more lower order cognitive functions, and these are things like basic mental processes, which I have listed there on the slide there. So this is things like, you know, just basic attention to something, or the speed at which we think, or just basic perceptual processes, so just being able to see something or hear something. So these are lower order cognitive functioning. But then we also have other types of cognitive processes as well, which are a little bit more involved, and we refer to them as more higher order cognitive processes. So these would include things like memory. Now, memory in itself is multidimensional, and there's various aspects to memory. For example, how we encode information in our environment, so how we learn information, is very different to how we remember that information over a longer period of time. And then we can also think about memory in terms of visual memory and verbal memory. So there's different domains of memory as well. And then we have things, we have language processes as well, which we consider to be a cognitive domain. So how we comprehend language, so how we hear language or how we speak, or just how we communicate with other people. Then we have these other cognitive functions that we refer to as executive functions. Now, executive functions, I remember what executive functions are because just by thinking of what a board of directors might do for a company. So if you think of a board of directors, so a board of directors is a group of people. They like to direct activities of a company. They like to organise events. They like to plan things. They'll come up with new ideas for their company. They will reason through problems for the company. They will stop problematic behaviours from occurring, that type of thing. So executive functions are just those same things that you would expect a board of directors of a company to be doing. And your brain has those same processes as well. And these are really quite complex cognitive processes that we have. Now, the thing about my occupation is that, so I'm a clinical neuropsychologist, and my job really is to work out, well, what happens when these processes, these cognitive processes, if things don't work out, or if these processes break down a little bit, or they become a little bit more difficult, you know, what is the nature of these difficulties and how is this going to impact on a person's everyday functioning? And that's generally what I do as a neuropsychologist. And my research has typically been aimed at better understanding these processes and how these processes really do affect people in their everyday lives. Okay. I'll also mention as well that there is a lot of new emerging research, and I actually did a postdoctoral fellowship in this area as well in something known as social cognition. And maybe this is, if you know a little bit about cognition already, you may not necessarily know about this term of social cognition. Now, this is a really new emerging area of research. It's been studied a little bit more in other neurological illnesses, such as traumatic brain injury or stroke, but it's really only just starting to emerge, and we're starting to get a little bit more of an understanding in MS on how social cognition is affected. And from my own research and some of the research of my colleagues, we are seeing that social cognition is something that can be affected in up to 30% of people with MS, and it's usually quite a mild thing. But what these social cognitive difficulties are about are difficulties in being able to perceive how another person is feeling or thinking. That's what we refer to as theory of mind. So just that understanding of how another person's feeling or thinking, and also having that level of empathy as well. So sharing those same concerns as another person. And also there's this idea of motivation and apathy. So just not having that drive to engage or connect with other people. All right, so now that I've told you some of the basics, which is really quite complex, about cognitive functioning, I just want you to just have a little bit of a think for a moment about your own cognition and whether or not that has changed since your diagnosis. You don't necessarily have to make a comment in the comments box, but just, think about this for yourself, and maybe you can even make a note about perhaps how your cognition has changed since your diagnosis. Maybe it hasn't changed at all. And also think about how these cognitive changes may have actually impacted on your life. Has it made certain things in your life a little bit more difficult? Potentially it's not all negative as well. Maybe there's some positive things that have happened as well. And then the third thing I'd like you to reflect on is whether or not you actually employ any strategies to help you if you are impacted by cognition in your everyday life. Are there certain things that you do at home that can make things a little bit easier for you? Okay, so I'll give you just a couple of seconds just to think about those questions.
Cynthia, do you want any comments that people are making?
No, I think this is really, more about self-reflection. I think these are just important things to think about. And I think this is something that maybe you can come back to at the end. And because there will be some strategies that I'll talk, general strategies that I often use. And maybe these strategies you can take on board yourself. And maybe they're strategies that you can help in your everyday life. But I feel like to actually implement strategies, you really have to have a good sense of how it is you are affected and what is affecting you. Not all of us can go out and have a full neuropsychological assessment done, but you might be quite aware of some of these difficulties that you are having. It could be as simple as, I'm just finding multitasking a little bit difficult now. And it might be that one strategy that you might use to help you is to perhaps just do one thing at a time, as opposed to trying to do everything at once, a little strategy like that.
Mm-hmm.
Okay, all right, but I'll move on. Okay, so I'll just talk a little bit more about cognition in MS and what we really do know about cognition in MS. But I first want to give you a little bit of history first, because I think the history of our understanding of cognitive functioning in MS, there's quite an interesting history there, to say the least. So Charcot was the person who we regard as the grandfather of MS. So he was the person who first characterized MS, which he did quite a long time ago, back in 1868. But as part of his descriptions of MS, he did make some mention of the fact that in some people with this condition, that there may be some cognitive functioning. Now, he didn't quite have the way of words that we would use today, so I won't repeat that sentence he actually had in his manuscripts when he wrote all the way back then, and we certainly wouldn't use those words today. But the important thing was that he did identify all the way back then that cognitive dysfunction could be affected by this condition. But the interesting thing is that despite that initial conceptualization, throughout most of the 20th century, MS was actually really regarded as a disease which was only had physical neurological symptoms. And in fact, in the 1960s, it was actually taught in medical schools that cognitive difficulties wasn't characteristic of MS at all. So this idea of cognitive difficulties was really not a thing for much of the 20th century. But it wasn't until the 1970s that there was a little bit of research to emerge that cognitive difficulties may be a thing in MS. And there were initial estimations that perhaps it was about 3% of people who were affected. But But then in the 1980s, there was a lot more research being conducted, and people started to realize, well, actually it's a little bit more common than we realize. But we now know from consistent research that cognitive difficulties can occur in around half of people with MS. So you may be somebody that doesn't experience any cognitive difficulties at all, but you might be one who does experience some cognitive difficulties. But I think to understand cognitive functioning in MS, it's important that we have some appreciation of the neurobiological mechanisms which might underlie this cognitive, the cognitive difficulties that we do see. Now, we know MS is a highly complex autoimmune-based neurological disorder, and it has both inflammatory pathways and neurodegenerative pathologies as well. So inflammation, we know, can lead to relapse and remission in MS, and this corresponds to what we know to be some demyelination on our brain cells or our neurons in the brain. Now, demyelination, so this is where the fatty coating on the neurons can break down a little bit. Now, this myelin, this fatty coating, is really important for our brain cells to be able to communicate. So this inflammatory process can create a little bit of demyelination, and which causes the conduction or the speed at communication to break down a little bit and to slow down a little bit. And that is largely what is thought to underlie a lot of the cognitive difficulties that do occur in MS. You can see those interesting time-lapse images there of the brain, and I've put that up there because I think this is really interesting to see. But my purpose of showing this is this MRI, it shows some bright spots, which we know to be MS brain lesions as a result of inflammation. But these brain lesions, they form, they grow, they shrink, and they disappear over 12 months. So this is actually in a man with relapsing remitting MS, and he actually didn't have any flare-ups of symptoms during this period of scanning. So this is actually over 1 year, and there's 24 scans that were conducted over 1 year. But you can see how these brain spots are changing consistently, but he didn't experience any symptoms at all. So in his case, he didn't have any cognitive symptoms. And I think it's important to realise that even though there may be some of this inflammatory process going on behind the scenes, that you may not have any cognitive symptoms at all. But it also is important for us to realise as well that some of us have developed what we know to be very good cognitive reserves. So because we've had a very good education and we've worked a lot and we've engaged a lot actively in the world, we have built in the past what we call this great cognitive reserve. So when our brain starts to play up a little bit and there are these lesions that come about, we have these amazing compensatory mechanisms in our brain that can help when these difficulties occur. So our brain is really quite remarkably plastic in that respect. Now, this is some recent research that was done, and I think I've put it up here because I think it really highlights why cognition is a really important thing to consider in MS. So the people in this study all had relapsing remitting MS, and they were assessed for their cognitive functioning at the time of their diagnosis. And they were grouped into 3 groups. There were a group of people who at diagnosis had no cognitive difficulties at all. There was a group of people who had mild cognitive difficulties, which is denoted by that MCI there. And then there was a group of people who had severe cognitive difficulties at their diagnosis, and that's the SCI there. Now, this study was conducted over 8 years. So what happened is they assessed people at baseline at diagnosis for their cognitive abilities, and then had a look at how they changed over an eight-year period. And what these researchers found was really quite remarkable, and that is that in terms of your physical functioning, that having cognitive difficulties at diagnosis actually meant that your level of disability was going to increase over that 8-year period, not by a huge amount, but by some degree, as you can see in this graph here. But also what was interesting though, and more so, is that there was a substantial amount of cortical change that occurred in people who had a severe level of cognitive difficulty at diagnosis. So what this is actually showing is that cognitive difficulties may actually be a very, very important marker of more detrimental outcomes in MS going forward. And this really highlights the need to really think about your cognitive functioning and how it's going, and think about your brain health, and think about whether there is anything that you can do to improve your brain health. And the other reason why cognition is important to consider is that cognitive difficulties can really mean that your everyday function can be quite significantly impacted. So in the past, I've done some work in how cognitive difficulties may impact on a person's ability to maintain their work. And my past research has demonstrated that if you're on cognitive testing, if your abilities on cognitive testing is a little bit lower than it should be, it actually means that you're more likely to reduce the hours that you work, and you're also more likely to leave work altogether. But it's also not just about your test performance, it's also about your self-reported difficulties as well. And just even thinking that you have some difficulties, which are likely to be real, of course, just even thinking that you have difficulties is enough for you to withdraw from the workplace as well. So even whether it's something that is measured or something that you think you have, it's really going to impact on the way you, on your functioning in everyday life, such as employment. But the way cognitive difficulties are experienced can be really quite different. And I just have up here on this slide just some of the things that I've heard in the past people say about the cognitive difficulties that are experienced. I often find that people do say that they feel like their intellectual skills have diminished. But in fact, intelligence is not actually something that is related to MS at all. What's actually really going on is that thinking is often slower, but this is perceived as being as a problem with their intelligence, when it actually isn't at all. In fact, verbal intellectual functioning is still there, and your vocabulary is still there. It's just that sometimes you might be unable to pull out a word when you need a word. So word finding might be a little bit difficult from time to time. Now, this is the results of a study that was done 8 years ago now. It was a New South Wales-based study, and I've just put this up because what it highlights is that when people self-report their cognitive difficulties, most of the time people don't really report difficulties all the time. And in fact, more often than not, people report that they have difficulties sometimes. So these difficulties are often not there all the time. They may be just there sometime, but of course everybody is going to be different. This is also a larger study as well. This is a North American study, the NARCOMS study as it's referred to. this is the results of over almost 24,000 people. And in this study, the participants rated the extent of their cognitive difficulties. But what you can see here is, just going down the graph, is how long the person had been diagnosed with MS for. So 0 means they'd just been diagnosed, 1 means that's 1 year post their diagnosis, etc., all the way down the bottom there to 30, so 30 years post-diagnosis. And what you can see here is definitely at the beginning stages after a person's diagnosis, you know, there's a large proportion of people who don't have any cognitive symptoms at all, or they may have very minimal cognitive symptoms. So very few people would have what we refer to as mild, which is this light green here, moderate, which is this darker green, or blue, which is the severe. But you can see that, I guess, over the first 10 years, the cognitive difficulties tend to emerge a little bit, but then after 10 years, they tend to plateau a little bit. So you can see that even here, that most people will still have minimal or mild cognitive difficulties. The other thing to bear in mind as well in MS is that not all areas of cognition are affected. Definitely what's not typically affected is a person's general knowledge. And I've also mentioned intelligence before, but intelligence is not typically affected. Basic attention is not affected either. Orientation, and by orientation, I just mean just being aware of your surroundings and knowing what time it is and where you are, etc. Language is not typically affected other than word finding. And some of the more basic memory processes are not affected either. But I'm going to go through now some of those areas of cognitive functioning that are more affected in MS. So this summarises some different domains of cognitive functioning and what tends to be more affected in MS. So here you can see processing speed, which is one of the hallmark features of MS. I've got a slide on that coming up, so I'll say more about that. But processing speed is affected in around 50% of people with MS. And then we have memory, particularly visual memory, is affected in around 50%. And then we've got verbal memory, which is around 30%. And then we have these other domains of cognitive functioning as well, which can also be affected in MS. So looking at this, it's really processing speed and memory processes that are more typically affected in MS. But I first just want to talk about thinking speed, or something that we refer to as speed of processing. So this is a hallmark feature of MS. And the reason it is a hallmark feature is because the underlying process is due to a loss of myelin on the neurons in the brain. So because of that loss of myelin, the connections between the cells in the brain tends to slow down a little bit. So that's why thinking can be a little bit slower. Thinking speed is really important as well, because if your thinking speed is a little bit slower, it can affect other areas of cognition as well, including memory and those executive functioning processes I spoke about. But attention is another area that can be affected in MS. So I mentioned before that simple attention is not affected, but more complex areas of attention are. So for example, divided attention, multitasking. So divided attention is that ability to be able to switch between tasks. So just as an example of multitasking, you might be working in an office, for example, and you might be required to do several things over the course of a day to meet your deadlines. And just by nature of having to do so many things over the course of the day, what actually might result is that you concentrate on doing one task, but then you might forget about doing the next task. Or it might be that somebody tells you something important, but you're not quite you don't quite hear them correctly because you're too busy concentrating on something else that you have to do. And then later on, you actually might remember, or you might think that, oh, you've actually forgotten something and you don't remember something. But of course, what's actually going on here is that you actually never attended to the information properly in the first place because there were other distractors and other things going on. But also too, we can talk about sustained attention as well, and being a fatiguing illness in MS, you may be quite significantly affected by fatigue. And that also means that sustained attention, your ability to maintain your level of cognition over a period of time, can be affected. Okay. Then we have this other area called working memory, and working memory is that ability to maintain and manipulate information in mind. And I guess it's like the loading dock for long-term memory store. So just to give you an example of what this might be like solving a maths problem. So for example, if you had to go to the shop and buy five ice creams costing $3.20 each, and if you gave the cashier a $50 note, you know, how much change are you going to get? Yeah, that's a question that really requires those working memory processes. So you're holding information in mind and you're manipulating that information. And that process is very highly related to processing speed. So if processing speed is a little bit slower, working memory tends to be a little bit slower by default as well. Now in this graph here, this is just from a research project, not mine, but it's from a research project done by the Kessler Institute in the US. So in this study, they had a look at these differences between secondary progressive MS and relapsing remitting MS. And they actually found that in relapsing remitting MS, impairments in processing speed and working memory were really quite a lot lower than that seen in secondary progressive MS. So when we're talking about secondary progressive MS, most people are going to experience difficulties in processing speed, but only about 30% will have difficulties in working memory. Okay, and then we can talk about learning and memory as well. So learning and memory, well, memory is one of the most reported symptoms that we do have in MS, and I've spoken a little bit about this already, but where the difficulties with learning and memory are in people with MS, it's not actually that you're forgetting the information. Usually what's going on here is that there's a little bit more difficulty in acquiring the information in the first place, and that can be because processing speed is a little bit more slowed, and also because of the attention thing that I just spoke about. But once you've actually learnt that information, there's a very high chance you're going to remember that information just like everybody else. So in terms of learning and memory, it's really more of an issue with acquiring the information in the first place as opposed to remembering the information over a delay. Okay, and just a study just to illustrate this point. So this was a study where they compared the number of trials it took for people to learn a 12-word list. In people without MS, they found that it took an average of 3 trials for them to learn a 12-word list. But in people with MS, it took on average around 8 trials. And that is, again, just because of the processing speed and the attention. Okay. And I've already talked about social cognition difficulties, so I'm going to skip that slide. Now, I'm very mindful of how much time I do have, so I'm probably going to try and speed things up a little bit here. But a few of you, and particularly if you're in Tasmania, you might have participated in one of the studies that I did a couple of years ago that looked at fatigue and the effect of fatigue on cognition. And these are some of the results here. What I was interested to know is that, you know, if you're undertaking some mental tasks over a relatively long period of time, in this case, we did a 2.5-hour session, I was actually interested to know how fatigue affected cognitive performance over that time. But what I actually found was really quite interesting. when it came to processing speed and working memory, I found that despite people's self-reports of fatigue getting much, much higher, performance didn't actually decline. So testing here occurred at around the 30-minute mark and then again at around the 2-hour mark. So performance didn't decline at all on these two domains of cognition. But interestingly, I did find a slight effect when it came to verbal memory. So when people are fatigued, then performance on a word list learning task did decline just a little bit. But you can see here, I've actually got a couple of comparison groups here as well. I've actually got a control group of people without MS, but I've actually got a group of people with chronic fatigue syndrome. But you can see generally that the overall pattern is the same. It's just that people with MS, their overall performance is just a little bit more reduced. But what I did find and what was really, really interesting is that when it came to the end of the testing session, around that 2-hour mark, I found that people with MS were actually making a lot more errors on basic attention tasks, and also their reaction time tended to be a lot slower on those on a sustained attention task as well. So despite previous research showing that basic attention is really not affected at all, my research is actually showing that yes, it is affected, but it's only affected when people are really tired. So fatigue can really, really, really play a role in cognitive functioning. And this graph here, this is also from my study, but this is really just showing that the relationship between a person's self-reported fatigue and the actual errors that they made on that sustained attention task, the relationship between that was actually much stronger when a person was tired. So when people are tired, they're actually much better at detecting, I guess, how much their performance has been affected. But if people are feeling like they're actually going okay, and they're not very tired, there's less of a relationship there. So basically it means that the more tired you are, you know, the more real it gets in terms of picking up the difficulties that you do have with your cognition. Okay, now just getting in now just to some cognitive strategies in terms of helping with difficulties with cognition. In terms of the evidence for rehabilitation for cognitive difficulties, this field is really still emerging quite a lot, and there is research coming out day by day, but I don't think it's quite as progressed as it is in other neurological disorders. One of the most studied types of rehabilitation as far as cognition is concerned is memory. And this group from the UK did a meta-analysis. And what a meta-analysis is, it's a large study that has examined prior studies, and it collates the results of studies to have a look at, well, is there really something going on here across all studies? And what they found is that, yes, that if you do some memory rehabilitation of some sort, then yes, it is going to help with your memory difficulties. And in fact, there is also good evidence too that it does help with your quality of life as well. But the funny thing is, though, that even though people went through these memory rehabilitation programs, it didn't actually improve a person's perceptions that their memory had actually improved. So on testing, it had improved, but people didn't think that it had improved, which I thought was really, really interesting. One of the conclusions, though, from this study, meta-analysis study, is that there really hasn't been enough studies conducted, though, in a person's everyday setting. So most of the studies have been conducted in laboratory university settings. So it would be useful going forward, I think, for more studies to be conducted in a person's everyday home environment, because I think there's a lot of difficulties there that can occur that you just can't pick up on in university studies that are done in a clinic. All right, so in my clinical work, one thing that I concentrate on a lot is really teaching people how to go about doing things differently. So any cognitive difficulties can be better managed by yourself. Now with memory, because memory is one of the #1 complaints I do get from people, one thing we can do is to get people to learn how to do things more effectively in the first place. And if you can encode information more effectively, then you're going to have a much better chance of remembering it later. So the type of thing that I would do is teach people how to rehearse the information that they get. So repetition and rehearsal of information means that you have a better chance of remembering it later. Increasing your exposure to information, so just sitting on it and thinking about it for longer and doing things slowly can also increase your chances of remembering it later. Writing down information and diarising information, of course, is a great strategy if you do have memory difficulties, but also visualising the information as well. I mean, often we hear things verbally, but if we can visualise the information and make up a story with the information that we're hearing, we do have a much better chance of remembering it later. So mnemonic strategies are one strategies that, you know, if you're keen to look up particular strategies, you could Google mnemonic strategies, and there's some great internet resources that can teach you how to use mnemonic strategies. There's some really interesting research coming out of the Kessler Institute in the US, which indicates that memory can really be improved if a person self-generates their own learning, and if you self-test yourself and self-test your own learning and also space your learning over time. So if you are trying to learn things, try and do it in small chunks, and also regularly take the time just to test your understanding and test your knowledge as well. And that is a great way of being able to remember things. When it comes to those executive abilities if you have difficulties, for example, in planning or problem solving, reasoning and organising, the best advice that I could give you there is to break things down into manageable steps. It's important not to try and do everything at once. I mean, as I said before, multitasking can often be quite difficult for people. So if you can break things down, do things one step at a time, plan, diarise, and do things well ahead of time as well. And if it comes down to making really big decisions, sometimes it's quite useful to write down a list of alternative things and even talk to other people about their opinions as well, and take that on board when you do make big decisions. And it's quite okay to ask for help as well. And of course, fatigue, we know, can impact on our cognition. So in that respect, in order to work more effectively, it's important to take regular breaks and to do things as well when you're most alert. And for most of us, being most alert is usually in the morning, but that's not the case with everyone. And there's also some cognitive behavioural therapy programs that are also available to help with fatigue as well. Some of you might have been doing the Facets program, which I think's running in Melbourne and Launceston at the moment, possibly in Hobart as well. I'm not sure about other states, but I think that's a good program, Facets, if you want to help manage your fatigue a little bit better. Okay, all right, I'll get now onto the more interesting stuff. So I'll talk now about brain health and cognition. Now, brain health is a really, really interesting thing, and it's really, really, really quite integral to cognitive functioning, as I'll explain now. So the brain is an incredibly complex organ in the human body, and it's one that defines who we are, but it's also one of the least understood. But what does it really mean to have a healthy brain? Well, good cognitive functioning is an indicator of good brain health. And I've hopped onto the Brain Foundation website, and because they had a really great page there on what it means to have a healthy brain and what you can do to have a healthy brain. And they had a list of things there which really hit the nail on the head for me. So the things that are listed on this slide here are all the things that you can do to create a healthy brain. And you can probably notice that all of these things on the slide are things that you can modify. These are things that you can change. So you have the potential to change things about your behavior that can promote a good healthy brain and very good cognitive functioning. So there is things that you can do. So modifiable lifestyle behaviors are definitely of particular interest to us because they can promote positive downstream effects on our cognitive functioning. And the other thing too is that all of these things here can improve brain plasticity. So doing these things can increase our brain's capacity to interact with the world, which is really quite cool, I think. Now, this slide here is the results of a study that has only just recently been published. Now, it relates to dementia, but I think it's really important to what we're talking about here. It's a recent paper that was put out by The Lancet. Now, The Lancet is one of the most prominent research journals there are. So this is really quite an important paper. And what it is suggesting is that there's 12 potentially modifiable risk factors which account for 40% of worldwide dementias. And then there's another 60% that we don't know really where the risk comes from. So it comes from other factors, say biological factors and the like. But to think that 40% of dementia cases can be avoided just by improving these modifiable factors, you know, it blows my mind that we can do that. You can see at the top, the little green circle at the top, less education predicts 7% of dementia. Education relates very, very strongly to that cognitive reserve that I spoke about earlier. So the cognitive reserve is really quite protective for our brain. So the more educated we are, the more we learn about life, the less chance we have of getting dementia. And then we have all these other modifiable factors that occur in midlife. Now, some of them, you know, we've got traumatic brain injury there, we've got hearing loss there, we've got hypertension, so stress, that's something you want to avoid. You want to avoid a bit of drinking. Obesity is a risk factor. So these are things that can come about in midlife. But later in life, there's these other things that tend to emerge. Depression can account for 4% of dementia. Social isolation is a big one, and physical activity. Yeah. So one thing that's really interesting and that has been really quite prominent in research presently is this thing about gut health. Now, you may have heard about the gut-brain axis, and that if we have a healthy gut, it actually promotes a healthy brain. Some of you may have heard that. And what research is telling us, and very recent research, is that people with MS, there are some abnormalities in the gut bacteria. And but what is interesting about gut bacteria is there are links between the gut bacteria in our gut and certain pathways in our brain. Now, I have one of those pathways up on the brain there, and this is the tryptophan kynurenine pathway. Now, I'm not going to go and explain this at all because it's really, really quite complicated, but there's kind of this relationship here between the gut, this brain pathway, and also in inflammatory pathways. So if we are able to promote a healthy gut, there is suggestion that we can also promote a healthy brain and in turn improve our cognitive abilities. Now, to improve our gut, we would think about the foods we eat, obviously, but you want to have foods that are high in antioxidants and also omega-3s and also tryptophan-rich foods as well. So antioxidant foods can include things like the flavonoids. I don't know if you've heard that word before, but it includes things like red wine, blueberries, cherries, strawberries, dark chocolate. The omega-3s, obviously, you know, we're talking about fish and things like that. And the tryptophan-rich foods include things like nuts and eggs and also fish as well, pumpkin seeds, that type of thing. So in terms of MS, there's still a lot of research going on here. So I'm not saying, you know, go out and change your diet. There's still a lot of groundwork and a lot of research to be done, but there is some emerging evidence coming out about the relationship between those foods and a healthy brain. So one of my PhD students, Terry, is actually studying this for her PhD. Now, if you're in Tasmania, you may have the opportunity to get involved in one of these studies. So we will be doing a trial in terms of improving gut health and the effect that that has on cognition. So if you are interested in that, you can email Terry. She won't be conducting that study probably until next year. So hopefully we'll be well and truly out of COVID time then. But yes, contact her. And I believe you'll also be getting these slides as well. So if you don't have a chance to write down her email, you can also get it off the slides later. Now, I know I've only got a couple of minutes left, but the other thing that has the possibility of improving cognition is to improve sleep quality. And this is another area that where really we don't know enough in terms of the effect of sleep on cognition. But some of my preliminary work where I've just looked at just the relationships between sleep quality and fatigue, you know, I'm certainly getting quite strong relationships, as this graph shows, between fatigue and overall sleep quality. And I'm also certainly getting some very strong relationships as well. I wouldn't say strong, moderate relationships between overall sleep quality and work outcomes as well. So if you have very good sleep quality, you're more likely to be working. So there is a bit of a relationship there. But interestingly, in my study, I didn't actually find very strong relationships between actual cognitive functioning and a person's self-reported sleep quality. So I'm not really sure what's going on there, but there are other studies that have shown that there is a relationship between cognitive functioning and sleep quality. So you can see here that a person's actual information processing speed, for example, is related to sleep efficiency, very similar to sleep quality. So I'm not sure why I didn't get that same effect in my study. But there has been very limited research in terms of treatments for sleep in MS and also the effect that improving sleep can have on cognition. Now, in terms of treatments for sleep, so there are pharmacological treatments, for example, melatonin. But at the moment, we really don't know much about how melatonin is affected in MS, particularly in view with disease-modifying medications. We do know that melatonin is reduced in MS, so there is a problem with MS, but we don't know exactly how that can be improved. There has been some suggestion in the literature that interferon beta treatments could actually affect sleep quality, but we really don't know. You may have been aware too that I've recently collected some data on sleep with the Australian MS longitudinal study, and we are looking at that relationship between disease-modifying medications and sleep. So just watch this space for that. We are starting to learn a little bit more in that regard. But the other thing too is exercise and you know, whether or not that can improve cognitive functioning. Now, we know that in older adults that exercise can do amazing things for cognitive abilities. And in fact, physical inactivity is quite a strong predictor of dementia. But what about in MS? Well, up until 2016, there'd really been very limited research conducted in terms of exercise and how it might improve cognitive functioning. But there was a systematic review conducted in treatments in MS, and basically the findings that they came up with was that there was a lot of conflicting evidence about whether exercise did improve cognition. But they also said that up until that time, the studies that had been conducted have been really ill-designed research studies, so they haven't been really well conducted. So we really don't know the full scope in terms of whether exercise can improve cognition. But I did find this really wonderful study that I think, and it's a recent study as well, and it compared two different types of exercise in terms of whether it improved cognition. Now, some of you may have heard of high intensity training. So in this study, they actually compared a group of people with MS who had done some high intensity training, where they just did very short bursts of exercise, against people who just did 30 minutes of just moderate exercise. And they did this over a period of several weeks. And what they found is that people who did the high intensity training, their verbal memory actually improved. They also made less errors on a sustained attention task, and their overall cardiovascular fitness improved as well. Now, you need to also bear in mind as well that not everyone can jump up and start doing exercise, so it really needs to be done in view of your mobility, but it really does show that those short bursts of exercise can potentially do quite good things for your cognitive abilities. And the final thing I just wanted to mention is on social isolation affecting cognition. Now, we know that in older adults, if you are socially isolated, so if you are living alone, or even if you self-report loneliness, it can really increase your risk of having cognitive difficulties. And in fact, it can also interact with, so in people with Alzheimer's disease, they have this genetic thing called the ApoE gene, and it can actually, if you are lonely, it can actually, in those people, bring on your symptoms of dementia a lot earlier. But if you are well connected, it can actually mitigate those dementia symptoms. So it's being socially connected with people is actually a really important thing. And there's been very little research done on this in people with MS, but I have done a little bit of work. And what I've actually found is that in my research, if you do have improved social support, that it is related to lower levels of fatigue, and in fact it's also related to better work outcomes as well. And I also found a small relationship there as well with cognitive performance. So if you have good social support, your cognitive performance is a little bit better. And in terms of engagement in social activities, if you're more willing to be involved in social activities, then this also is related to lower levels of fatigue, work outcomes, and cognitive performance as well. But we also need to bear in mind here, what is the chicken or the egg here? But certainly it does warrant really a bit more of a thorough investigation about the effects of social connectedness in terms of our cognitive functioning and how it affects everyday life. Now, given we're out of time, I won't talk about this slide, but I do just want to mention that depression it can really undermine cognition as well. And in fact, in terms of if you do have cognitive difficulties and you are depressed, it can really impact on your brain health. So I think it's really, really important that if you are experiencing symptoms of depression, that you do try and get that addressed, because I think that it can really significantly affect your brain health. So that's it from me. So I will open it up to questions. And I think we're about 1 minute over, I think. Are we, Andrea? 2
That's
minutes
fine.
over?
Yeah, it's over, but that is
Sorry.
fine. No,
Yes.
not a problem at all. And we fully understand if people need to leave, but by all means stay on, because we'll be just sharing. I'll give you a couple of minutes to throw in some other questions, but then I'll be looking at the comments and sharing some of those with Cynthia as we go through. So I'll give you just 2 or 3 slides to give you that space to type in a question if you want to type in something. And one of those is to remind you to contact MS Connect for anything. The team at MS Connect are there to answer your questions, to follow things up for you, to connect you with other services, and they're only a phone call away. And it's great to hear the benefits of social connection, because peer support is all about that. So if you're not currently involved in a peer support group, or on a phone-based group, or even through through Facebook, we would very much encourage you to reach out to the girls. That's the peer support team on the screen there. You've got Kat and Kim and Ange, and there are a whole lot of groups all around the place that you can connect to. I might leave that one. I've chatted to a couple of people during the session about the things that they've noticed impacting them at work around their cognition. And so I would just encourage you to explore the Employment Support Service at MS. That's a program very much designed to help you and support you in your work. So if you're not already connected with them, find out a little bit more on our website. And if you're involved in the NDIS, or indeed with My Aged Care as someone over 65, we're also here to help you navigate that. That's a plug for podcasts. And now let's go and just have a little look at some of the comments along the way. Now, some of the questions I believe you actually answered along the way. So again, like I said at the start, if I don't fully answer your question, please let me know or follow up, but I think some of them have been actually covered. So let me just have a little scan here.
Although having said that, Andrea, I think, I did go through at quite a quick pace. So I think there's probably a lot of things that could very easily have been missed. So I'm happy to revisit things if you think they're important.
Okay, that's lovely. That's lovely. I think you might have covered this, but you might want to speak a bit further to it. The impact that some medications might have on cognition as well, like separate to the impact that MS can have.
That's a really good question. And typically when treatments are being evaluated, they're not really evaluated in terms of the effect that they have on cognition. Most of the time they're evaluated in terms of the effects that it has on physical functioning. So we can only work on the assumption that if you're using disease modifying therapies or on some medication and it is improving your well-being, particularly physically, that it would be doing what it can do for your cognitive functioning. I think if you are concerned about whether or not your therapy is working or helping you with your cognitive function, it probably would be best discussed with your neurologist, because I think it's a very individual thing here as well. And it's also potentially too, there might be a need if you're, experiencing quite significant levels of fatigue. It might be that your fatigue's also impacting. So it may not just be the medication, it can be other things. So it's really hard to tease out what is medication-based and what is not. Yeah, and also too, it may be that the medication that you're on, it might need to be supplemented with other medication that can improve your symptoms of fatigue. Some of the research that we've been doing in relation to fatigue and that brain pathway I spoke about earlier, that really complicated looking thing. So that's actually, that pathway of the brain, good functioning of that pathway is actually promoted by niacin, which is vitamin B3. So yeah, but we haven't fully evaluated that yet. So that could be a additional thing that you could take in addition to your normal disease modifying medication, but it's something you'd want to talk to your neurologist about. I'm not qualified to give advice on medication, but yeah, but we are doing a little bit of research in that area. Yeah.
Thank you. Yeah, that's
No
great.
worries.
Someone else also just made the observation that heat impacts their cognition, and I think a
Yes.
lot of people would find that heat can amplify any of your existing symptoms, so that would include cognition as well.
Oh, absolutely, yeah. So whenever I do any of my research studies, I always make sure that I'm in a very good temperature controlled room, because I'm very, very aware of that fact. And it can really bring on fatigue quite quickly. And I'm not aware of any studies that have been conducted in that respect, but I don't know that there would be, because I actually think it's probably unethical to conduct research where you're actually exposing people who are quite affected by heat conditions, which could be really quite detrimental. So I don't think you'd find any research in relation to that, but definitely from my clinical experience, yeah, heat it's terrible, yeah. So
it might be one of the factors that they're researching when the University of Sydney, I think, are doing research on heat intolerance.
Are
And
they
so
really? Okay.
they might include cognition in that, but
Cognition,
it's
yeah.
largely physical function.
Physical, yeah.
Yep. Yep.
Yeah, that's interesting.
You mentioned the Facets program, and I've made a note to myself to send everybody that's been part of tonight some of the information about Facets.
Yes.
I don't believe it's running as a face-to-face program anywhere at the moment, but MSL is running it as a webinar-based program, and the developers in the UK have actually launched it as an online self-directed program.
Yeah.
So
Yeah.
I'll send everyone the links for that. There's a question.
Yeah. Can I just add to that, Andrea? So Ingrid van der Meij, the Menzies, and myself and a few other people, we've also developing a program that we've developed based on the Facets, but it's more applied to the workplace, and it's called MS Work Smart. So that's currently in development at the moment. So that's probably going to come out maybe, I'd say it's probably not going to come out until at least mid next year, but just keep your eye open for that as well. And that'll be an online program too.
Okay, great. That's great. A question about the motivation in MS. Is there more research or information on the connection of motivation? Is that part of cognition?
Yes, it is. It is part of cognition, and that's a really, really good question, because I don't think it's been well researched in MS at all. I have some very good colleagues who study the dementias at Sydney University, and they've only literally just started examining that in the last couple of years in dementia. And they've actually found that there's several different dimensions of motivation. I can't quite remember what the different dimensions are, but there was one dimension that related specifically to a lack of motivation to be socially connected. And then there was a different type of motivation that related specifically to engaging in mental activity. And then there was another type of motivation that related specifically to feeling things, so to show that effect. So there was all these different dimensions of effect, and it certainly hasn't been investigated in MS at all. So I think that is an area where potential research could go in the future, but we're certainly not there yet. Maybe I might decide to do that. But who knows? Yeah, because that type of thing really, really interests me. Yeah.
Absolutely, fantastic. A comment, if you would like, on pre and probiotics. Are they a good idea for gut health?
Yes. So my PhD student, the photo I put up, so that was Terry. We've just actually conducted a meta-analysis study. We've only just submitted the paper actually, and we did a meta-analysis review of current studies that looked at gut health, prebiotics and probiotics to improve cognitive functioning. Now, it wasn't a study that was specific to MS, so we're just looking at across it from everyone. So most of these people were people without MS, healthy individuals who have no condition at all. But we did actually find that there is some evidence that, yes, they can improve brain health, basically, yes. So the upcoming study that my PhD student will be doing, she'll be doing an MS-specific study looking at a specific treatment using probiotics. So there is no research yet, but hopefully we'll be the first. So watch this space.
Right. I think there is some work being done from Deakin University. We've had a researcher update from Wolfgang Marx on the gut microbiome.
Yeah, so Wolf's actually part of our study as well. So
Oh,
I guess where the difference is I guess we're looking specifically at cognition. Yeah, whereas his work's not.
Right.
So, but yes, no, Wolf and Terry and I, we're all working together. So yes.
Terrific. That's great. A couple of a combined question. We've had a question about how do you get cognition assessed, and then a couple of people asking about the benefit of brain games. So assessment and brain games.
I knew that question was going to come up. I'll answer the getting cognitive assessment question first. I think that can be a very, very difficult thing is to get a cognitive assessment. I know I do assessments at Launceston General Hospital, and you know, for me, I need to get a referral from a neurologist. So I think if you can get your neurologist to refer you to a service, that would be a start. Otherwise, you could get one done privately, but that is going to cost a lot of money because cognitive assessments are actually quite big, depending on the practitioner. You could be charged anywhere between $1,000 to $2,500 for an assessment if you do it privately, which is really quite a lot. Now, I know MS Limited used to employ some psychologists, but they don't anymore. So I think that's
a long time ago.
Yes. Yeah. So that's a service, sadly that's not there anymore. The other thing that you could do potentially is get involved in research projects as well. Potentially you could, because, you know, if you dedicate your time to a study where there is cognitive testing going on, then you may be able to obtain the results of that from just participating in research. So some of people who have participated in my research, I mean, ethically, I'm not allowed, because I am the researcher, I'm not allowed to give them the results directly, but I can give those results to another psychologist who can then relay those results onto them. So that's a nice, tricky way of getting it done. I think if you're remote and not in a metropolitan centre, it's quite tricky because there's very few neuropsychologists around who can do those assessments in rural areas. So yeah, it can be tricky to get them. But in terms of the brain training programs, so that's a really, really good question. There is a general consensus from neuropsychologists worldwide that brain training programs do not work. So we recommend against using them. However, there was a very good study that was released about 2 years ago by some colleagues of mine in Sydney, and they reviewed all of the research literature and found that, in fact, in people with MS, it tends to work more, these brain training programs, than any other neurological illness. I don't know why, but there's more promise for them in MS than there are any other condition. And where it seems to be most effective is in improving processing speed and improving memory. But the thing to bear in mind is if you do these online training programs, typically the improvements are very specific in the task that you're doing. They don't tend to generalize into your everyday world. So you just need to keep that in mind. One of the pieces of advice I always give people is rather than spending a lot of time doing these brain training programs, you can get the same benefit or even more benefit just from living an enriched life. So you can develop your brain and develop, strengthen those connections in your brain just by actively involving yourself in new learning and doing new things, being socially connected, attending sessions with MSL. So I had to throw that one in there, Andrea. Um, yeah, so from a clinical point of view, I think, yeah, you know, if that ticks your boxes and you want to do brain training, yeah, do that. But I think just living an enriched life can do that and more.
That's fabulous. There's a couple of questions coming in around strategies for improving processing speed.
Yeah, that's a very good question too. I did actually have a slide on that, but I deleted it because I didn't want to confuse anyone. At the present, there's not a lot of research about processing speed except for what's being done in terms of the brain training programs. So the brain training programs, they can improve a person's processing speed, but we know again that that doesn't translate into just everyday functioning. But there has been some very recent research done again with the Kessler Institute in the US. They seem to be at the forefront of all treatments. They're very, very well funded over there. Sadly, we're not as well funded in Australia. But they actually found that you can improve processing speed by doing some like distractor type computer-based tasks, which when I read the article and the information on this, it reminded me a lot of, you know, when you play computer games and you've got several things that you have to concentrate on at once. You know, if it's a shooting game, you know, you have to shoot at one thing and then you have to watch that you're not being killed. So it's trying to build up your capacity to work a little bit more quicker and to look at several distractors at the same time. So they're the types of tasks that they'd been trialing on people with MS. But in terms of physical activity too, you could even, you know, a game of tennis or something like that would be really quite equivalent as well, because, you know, you're trying to do a few different things at once and it's really about paying attention and, you know, trying to be very quick to react and things like that. And you can build skills in that over time. So yes, I think there are things that you can do in processing speed, but in terms of the research coming out, I think there still needs to be a lot more to come out in that area. Yeah.
That's fabulous.
Yeah.
There are some great comments. There's lots of thank yous coming in for your presentation, Cynthia, and many people are really appreciative of the information and the motivation to exercise, to think about their nutrition, and to sort of take it a bit more seriously, that whole idea of looking after their brain. So that's fabulous.
Yeah, I think it is. It's a very important message, and I don't think it had been taken quite seriously in the past. But yeah, these modifiable lifestyle factors, and I think there was something that came out today, wasn't there, on MSL website? There was a little booklet being released on modifiable lifestyle factors in MS, like a little how-to guide or something.
MS Australia, but yes, part of the brain health research, that the research group that have published the brain health material, I believe there was. Yeah, that's fabulous.
Yeah, now I don't think that resource is specific to cognitive functioning, but I think it would be a good thing to read just for MS generally. Yeah.
Yeah, absolutely. Absolutely. That is great. Look, I'm sorry if I haven't got to your specific questions. There's some that are very specific and they might be better followed up afterwards. But I thank you so much for your time tonight, Cynthia. It's been absolutely fabulous. I hope everybody's enjoyed this virtual dinner conversation and our guest speaker, and I'll look forward to seeing you at future webinars. It's just been really lovely spending the time, challenging but inspiring as well. I'm sure some parts of the presentation people kind of did a bit of a cringe, but it's so important to take seriously our brain health, particularly when people are also living with a condition like multiple sclerosis. So thank you for your encouragement, thank you for the positivity, and thank you for all the information you put together.
Thanks, Andrea.
No problem. Thanks everyone for being online. We'll look forward to seeing you at future programs. But for tonight, I wish you well. Thank you.